Hello students, now I am going to teach you the diet in infections, fevers and surgical conditions, and this is very important as we have come to learn about the therapeutic nutrition. So let us start with fevers, its types and symptoms. Now fever, it is an elevation of temperature above the normal and results from an imbalance between the heat produced in the body and the heat eliminated from the body. Now in normal adults, the average oral temperature taken through a thermometer is 37 degrees centigrade, or what we call in Fahrenheit as 98.6 degrees Fahrenheit. Now fever of unknown origin, where we don't know why the fever has occurred, is defined as a febrile illness lasting more than 3 weeks with temperatures which exceed 38.3 degrees centigrade on several occasions, and they lack a definitive diagnosis after 1 week evaluation in the hospital. Now it is a complex physiologic reaction to the disease involving a cytokine mediated rise in body temperature. The types of fevers include the drug associated fevers, the transfusion associated fevers and the infection associated fevers. Now common fevers are almost always classified broadly into 3 elementary categories: bacterial infections, viral infection and parasitic fevers. The types of fevers I'll just list out quickly: influenza, malaria, typhoid fever, measles, chickenpox, rheumatic fever, meningitis, dengue fever, smallpox, chikungunya and viral hepatitis. So these are the types of fevers, and let us see how long the fevers last under duration of fevers. The short, intermittent and long. This is called as acute infection, and for the first one we will see malaria. It lasts from several days to months. Cold, tonsillitis, influenza, TB and typhoid, chickenpox, scarlet fever. The fever might be caused by endogenous factors, antigen antibody reaction, malignancy, that is cancers, and rejection of the transplants or graft rejections as we call them. Then we have exogenous factors, bacteria and fungi and viral infections. Certain inflammatory conditions such as rheumatoid arthritis, inflammation of the lining of your joints, which is synovium. Some medications also cause fevers such as antibiotics and drugs which are used to treat high blood pressure or seizures. Now some immunizations such as diphtheria, tetanus and acellular pertussis or pneumococcal vaccines also cause fevers as a reaction, antigen antibody reaction in the body. Now heat exhaustion, that is extreme heat or what we call sunstroke or extreme sunburn, they also cause fevers as a reaction in the body. Now metabolism in fevers. The most important changes which may affect the nutrition are an increase in the metabolic rate amounting to 7% for every Fahrenheit degree rise in the body temperature. There is decreased glycogen stores during fevers, that is, the body gets exhausted because of high metabolic rate. It uses all the glycogen as a source of energy, as the person does not have appetite and does not consume sufficient food. Now accelerated loss of body water owing to the increased perspiration and the excretion of body waste, increased excretion of sodium chloride and potassium, those are the electrolytes or essential salts from the body, decreased motility and reduced absorption of nutrients results during fevers. There is an increased protein metabolism which is especially excessive in typhoid fever, malaria and others. The additional end products of protein metabolism excreted as urea place a heavy burden upon kidneys in fevers. Now let us see what are the symptoms of fever. Rise in the temperature of body heat is one of the most common and the most important by which we identify fevers. Perspiration or shivering, restlessness and agitated temper. A person loses his temper at short notice. Pain and soreness all over the body, but some limbs may be extra painful and sore. Excessive thirst and loss of appetite. Let us see what are the dietary modifications in fevers. First, we always start with energy modification. The intake of energy should be increased by about 50% in case of high fevers which are lasting for longer periods. However, due to fever, the patient's appetite is poor and the digestion may be impaired or hampered. Hence, maximum calories that are tolerated by the patient should be given. Carbohydrate. Since the glycogen stores are reduced, they have to be replenished by liberal intake of carbohydrates. They should be high and as much as possible. It is advisable to add glucose in all liquids and fruit juices given to the patient because the carbohydrate has to be in the easily assimilated form. Protein. A high protein diet supplying about 1.25 or 1.5 grams per kilogram of the body weight should be fed to the patient. Now, protein supplements can be incorporated as the patient is in no position to eat large quantities of solid food. These can be in the form of beverages when the digestion is affected. Pre-digested beverages may prove useful. Fats. These can be used liberally as in case of rich sweetmeats and foods which contain large amount of fats. Now, what are the minerals that we need to modify? Because of the loss of the two electrolytes sodium and potassium, they should be replaced, otherwise the patient will be dehydrated. Therefore, sodium in the form of salt in soups, dals should be given liberally. Potassium, which is also needed in greater amounts, should be given fruit juices and milk, which are good sources of potassium. Now, let us see what vitamins they should be in the form of supplements to the patient. It can be in the form of a multivitamin pill or a pill of B complex vitamins. Now, fluids. Plenty of, since there is a loss of fluid from the body in the perspiration, plenty of fluid should be given to replace the lost fluids and to improve the excretory waste. Now, coconut water, fruit and vegetable juices and soups are advised. These help to flush out the excretory products from the kidneys. What should be the texture and consistency of the diet? Let us see now. Soft texture and fluid to semi-solid consistency are desirable to promote appetite and help the patient to consume a diet which is nutritionally adequate. These feedings should be small and as frequent as possible because the patient is unable to consume large quantities of food. 6 to 8 small feedings should be sufficient. Now, infections and their nutritional management. A disease, let me define the infection for you. A disease which is caused by a microorganism, especially those that release toxins or invade the body tissues. Worldwide, infectious diseases such as malaria, tuberculosis, hepatitis virus and diarrheal illness produce more disability and death than any other disease. The interaction between the nutrition and infection is synergistic, that is, nutritional deficiency lowers the resistance to infection and infection aggravates the existing malnutrition. So, persons who are chronically undernourished not only succumb to infection much more readily or more faster, but have a longer period of recovery than do the well-nourished persons. Now, in developing countries, infants and preschool children are the most vulnerable. That means those are the people who get mostly affected by the infections. Nutritional needs are generally increased during infections by the following mechanisms. Let's study these mechanisms. The stress reaction induces a catabolic response. Catabolic means more and more amount of protein, carbohydrates and many other nutrients are breakdown is catabolic process. They increase with losses of nitrogen, magnesium, potassium, phosphate and zinc. Infections or if fever is present, the increased metabolic rate raises the energy needs of the patient. Anorexia, that is lack of appetite, decreases the food intake of the person, and nutrient losses may be increased due to increased perspiration, vomiting or diarrhea, which are the normal or common symptoms of infections. Now, tuberculosis is an infectious disease which is caused by the Bacillus mycobacterium tuberculosis. It affects lungs most often, but may also be localized in other organs such as the tuberculosis of the lymph nodes, the intestine, the meninges, the bones and joints, skin, or it may be even generalized. Tuberculosis is one of the leading causes of sickness or morbidity and mortality, that is death, among the adult population in India. Now, let us study the symptoms of tuberculosis. Pulmonary tuberculosis means the one which affects the lungs of the patient is an inflammatory disease of the lungs accompanied by a wasting of tissues, exhaustion, cough, expectoration and fever. In acute form, it resembles pneumonia because the temperature is high and circulation and respiration are increased. The chronic phase is accompanied by low grade fever, and though the metabolic rate is high, it is lower than in acute fevers. As the disease progresses, the patients begin to exhibit loss of appetite, one of the main symptoms, pain in the chest, fatigue, weight loss, night sweats and persistent worsening cough. These are very common symptoms of tuberculosis. Now, let us study the nutritional requirements or modification in the nutrient composition of the diets of such patients. Energy, because the metabolic rate is not as high as in other fevers, satisfactory weight gain can be maintained with 2500 to 3000 calories. High calorie diet is prescribed. Protein, the serum albumin, especially in advanced tuberculosis and in cases of long standing, may be low. Therefore, the daily requirement may be 80 to 120 grams, which is desirable. Minerals, at least 1 liter of milk should be taken daily. The iron needs may also be increased if there has been hemorrhage. Hemorrhage means bleeding. Now, calcium, iron and phosphorus help in regeneration of cells, blood and fluids. Vitamins, vitamin A, C requirement increases. So, what are the principles of the diet? A high calorie, high protein, high vitamin and minerals and high fluid diet which is soft in texture is recommended, along with 1 liter of milk and 3 to 4 eggs per day. Next is HIV or human immune deficiency virus. Now, as I said, this attacks both the immune system and the nervous system. Immunity refers to the resistance to or protection against the specified disease. When the AIDS virus enters the bloodstream, it begins to attack cells with a specific protein called CD4 on their surfaces. This CD4 is present on lymphocytes and CD4 levels decrease as the HIV disease progresses. Loss of CD4 function leaves an individual susceptible to infections and certain cancers. Evidence showed that AIDS virus may also attack the nervous system, causing damage to the brain. AIDS is a disease complex characterized by a collapse of the body's natural immunity against disease. Every part of the human body may be affected. On an average, it takes about 10 years for HIV virus to progress to AIDS. This disease is often diagnosed after certain indicator, that is opportunistic diseases occur, such as infection, tumor, wasting or dementia. Signs and symptoms. The natural history of HIV infection is divided into three phases: early symptomatic clinical latency, advanced HIV disease which is called as AIDS. Early symptomatic phase, the HIV infected individual may develop an acute flu-like illness with symptoms appearing for about 2 to 6 weeks after exposure to the virus. Typically, the symptoms are not severe enough for the client to seek medical attention. Now, clinical latency. After this phase, the individual may be asymptomatic for years. Most HIV infected persons have no symptoms and many are not even aware that they are infected. The danger lies in their ability to infect other people unknowingly. Some people remain symptom free for years after infection with the HIV virus. Even though the client is symptom free, viral replication continues. If untreated, there is a steady decline in CD4 level cells during this stage. Advanced HIV disease phase, that is AIDS. After a period of 2 to 10 or more number of years without treatment, the CD4 count drops to less than half the normal value. The viral load increases and the immune system begins to fail, permitting opportunistic infections and other conditions which are characteristic of AIDS. When the CD4 cell count drops to less than 50, there is an increasing chance of the treatment failure. Death becomes likely, usually within 1 year. Now let us see the complications of HIV infection. AIDS is characterized by extreme weakness, anorexia, diarrhea, weight loss, fever and a decreased white blood cell count, or what we call leukopenia. Now, common problems which are associated with the AIDS patient include opportunistic infections, gastrointestinal dysfunction, tumors, AIDS dementia complex which is known as ADC typically, and organ dysfunction. And in the last years, several clients have developed a syndrome of lipodystrophy that is characterized by peripheral and facial wasting, in which all the veins in the extremities are prominent and the abdomen is enlarged. The opportunistic infections include parasitic, bacterial, viral and fungal organisms are everywhere in our environment. The healthy person's immune system keeps these organisms in check and under control. But AIDS places the client at high risk for certain infections called opportunistic infections. 4 opportunistic infections are commonly seen in AIDS client, which is thrush, tuberculosis, pneumonia and cryptosporidiosis. Let us see the nutritional requirements. 20 to 30% additional energy depending on severity of symptoms, translating to food equivalent. Children who are asymptomatic need 10% more energy to maintain growth. Those who are symptomatic, their energy needs increased by 20 to 30% more per day, and those experiencing weight loss require 50 to 100% more energy per day. Now, protein requirements. High protein is required on the onset of opportunistic infections because of the body losses of nitrogen. HIV infected persons often have pre-existing protein energy malnutrition (PEM), which is not a deficiency of one nutrient but inadequate intake or poor utilization of food and energy. WHO recommends the same RDA for non-infected persons, that is 1 gram per kg of body weight optimum protein intake. Adults 1.2 to 1.5 kg body weight and children 2.5 to 3 grams per kg body weight. Pregnant and lactating women have higher protein needs, therefore they are recommended 12 to 15% total energy intake on average of 50 to 80 grams of protein per day. Fat requirements. As per WHO, the RDA for HIV non-infected person is 30% more of the total energy needs. Micronutrients. Deficiencies are common in HIV. Prevalent areas, especially vitamin A, B complex, C, vitamin E, selenium, zinc, iron, iodine, magnesium, etc., calcium are strong for immune system. Therefore, deficiency of antioxidant vitamins and minerals contributes to oxidative stress, which accelerate cell death and increase the rate of HIV replication. Dietary fiber requirement. Roughage, food component that enhances the bowel movement and the health of the digestive system. Water requirement, essential nutrient for transportation of nutrients, removal of waste, assists in metabolic activities and provides lubrication and regulation of body temperature. One should use clean and safe water, which the water should be boiled for about 5 to 8 minutes, and proper treatment of the water should be done to kill all the bacteria to avoid opportunistic infections. Sepsis is a life-threatening illness which is caused when the body is overcome by infection. It is often called septicemia or blood poisoning when the body is fighting a severe infection that has spread via the bloodstream. This condition can develop either as a result of the body's own defense system or from toxic substances made by the infecting agent, whichever it may be, either bacteria, virus or fungus. So students, now I'll be talking about the nutritional needs for a surgery patient. Now, nutritional needs in general surgery patients. First, we deal with the pre-operative nutrition. How to prepare a patient for surgery by improving his nutritional status. Now, before elective surgery is undertaken, nutritional deficiencies should be identified and corrected. Now, all the surgical clients should receive instruction in the weeks before the surgery. How? Let us see. Protein. The most common nutritional deficiency related to the surgery is that of protein. They have to build up the protein status in the body, and energy. Sufficient kilocalories should be provided to build up any weight the patient is having low or deficit. Vitamins and minerals. Normal tissue stores of vitamins are needed for the metabolism of carbohydrate and protein. Water and electrolyte balance should be maintained, and after surgery, immediate pre-operative period, what we call, usually nothing is given by mouth for at least 8 hours before surgery. The stomach will have to retain food at the time of the operation. In case of emergency surgery, if the patient has recently eaten a meal, gastric suction is used to remove it. Food in the stomach may be vomited and aspirated during surgery or recovery from anesthesia. Therefore, no food is given 8 hours before the surgery. Now, planning the preoperative diet. Patients who have lost much weight prior to the surgery may benefit considerable by ingesting a high protein, high calorie diet. The diet may be of liquid, soft or regular consistency depending upon the nature of the pathological condition. Foods which provide maximum amount of nutrients in a minimum volume are essential. Small feedings at frequent intervals are likely to be more effective than large meals. Additional protein, milk beverages may be fortified with non-fat dry milk powders or commercial protein supplements. Excessive use of sugars and fats may provoke nausea, therefore they need to be avoided. Food and fluids are generally allowed until midnight just preceding the day of operation. A light breakfast may be given when the operation is scheduled for afternoon and local anesthesia is to be used. When the operation is to be performed on the gastrointestinal tract, a diet low in residue may be given for 2 to 3 days before operation. Post-operative nutrition. In surgical diseases, losses are greatly increased. At the same time, replacement of nutrients from food is diminished or even absent for an extended period. Therapeutic nutritional support therefore becomes all the more significant as a means of aiding recovery. So, let us start with proteins. In the post-operative recovery period, adequate amount of protein intake is of primary concern to replace the losses and supply increased needs. There are number of reasons to increase the protein demand. Let us study them. First, tissue synthesis in the wound healing, avoidance of shock, control of edema, bone healing, resistance to infection, lipid transport, etc. Energy. A sufficient kilocalorie intake is essential and often critical to the successful outcome of surgical procedures. Protein. A high protein diet is recommended. Fat must be adequate to maintain the body tissue fat reserves but not excessive. Fluids. During post-operative period, large fluid losses may occur from vomiting, hemorrhage, exudates, diuresis, fever, sweating and increased metabolism. It should be maintained in sufficient quantity according to individual need. Minerals, electrolyte losses, especially sodium and chloride, accompany fluid losses. Iron deficiency anemia may develop from blood loss during surgery or from faulty absorption of food. So, therefore, the diet should contain enough quantities or more quantities of iron. Vitamins. All of the vitamins play important roles in the healing process, especially vitamin C needed for wound healing, and in minerals we can also supply zinc, etc. Planning the post-operative diet. Post-operatively, the healing process requires increased amounts of protein, vitamin C, K, zinc along with adequate amounts of other nutrients. Vitamin C is necessary for collagen formation, vitamin K for blood clotting and zinc for tissue growth. Bone formation, skin integrity, cell mediated immunity and generalized host defense. Resumption of oral intake depends on the nature of the surgery and the individual's progress. Intravenous fluids are continued after surgery. After minor surgery, liquids are tolerated within a few hours and rapid progression to a normal diet is made. Patients are usually progressed from clear liquids to full liquids, a soft diet and then a regular diet as soon as possible. The progression thus varies with the patient and the surgical procedure. It may be hours or days. After gastrointestinal surgery, oral food and fluids are deferred longer with other surgeries to allow for healing. Giving the exact amount of food or fluid prescribed is important. More is not better if the patient's stomach or intestine has been sutured. It is not advisable to give red liquids such as gelatin or cranberry juice after surgery on the mouth and throat, so that vomitus is not mistaken for blood or vice versa. Surgical removal of a part of the gastrointestinal tract such as the stomach, duodenum, jejunum or ileum may result in malabsorption of specific nutrients. So, here we complete totally the nutritional needs of patients or clients suffering with fevers, infections and those who have undergone surgeries. Very clearly, the nutritional needs vary from condition to condition, patient to patient, depending upon their individual need. But one thing you must have seen, protein intake needs to be maintained, or a higher level of protein is given either in fevers, infections or surgeries, because it is an important nutrient which helps in faster wound healing and helps in building up of the protein stores in the body and builds up immunity in an individual. Okay, thank you so much.